Many patients are shocked when jaundice turns out to be the very first and sometimes the only symptom of pancreatic or bile duct problems. So why does this happen? Let me explain it simply. Jaundice happens when bilirubin, the yellow pigment that normally drains from the liver to the intestine, builds up in the bloodstream. One of the most common reasons for this blockage in adults is a tumor near the head of the pancreas pressing on the bile duct. The bile duct is a narrow tube that carries bile from the liver into the intestine, and it actually passes through the head of the pancreas. So even a small growth in this region can block it early. In pancreatic head cancers, this type of jaundice is often called painless progressive jaundice, meaning the yellowing gradually increases without any pain. On the other hand, peri-ampullary tumors, that is, tumors near the opening where the bile duct drains into the intestine, can cause waxing and waning jaundice, where the yellowing comes and goes. This happens because these tumors can intermittently block and unblock the bile duct. These terms simply describe the pattern of jaundice and help doctors understand what might be causing it. What makes this tricky is that the rest of the symptoms are often very vague or mild. Patients may not feel any pain at all. There may be no weight loss, no digestion issues, no back pain, nothing dramatic. But because bile has nowhere to go, it backs up into the bloodstream and the eyes turn yellow. That is why jaundice can sometimes appear before any symptom has even started. In contrast, tumors in the body or tail of the pancreas don't touch the bile duct, so they rarely cause jaundice early. That's why head of pancreas tumors are often detected sooner. Jaundice acts like an alarm bell, but it's important to remember that jaundice alone doesn't mean cancer. Stones, strictures, infections, and benign narrowing can also block the bile duct. For doctors, the moment jaundice appears, the next step is almost always imaging, usually an ultrasound or CT scan, to locate the blockage. Treatment may involve endoscopy, stenting, or surgery depending on the underlying cause. So when jaundice shows up unexpectedly, it's the body's way of signaling that something deeper needs attention. Share this video. It may help someone understand why sudden jaundice should always be checked early.